The new Cancer Center at the University of Maryland Capital Region will offer a multidisciplinary approach and comprehensive cancer services, including prevention, screenings, diagnosis, treatment, and post-cancer care, opening this spring. Joining us to tell us more about it is Dr. Magesh Sundaram, the Director of Surgical Oncology and Medical Director of the Cancer Center at Capital Region Health, and Associate Professor of Surgery at the University of Maryland School of Medicine. Thanks so much for joining us.
Thank you for having me today.
This brand new 4-story, 100,000 square foot Center for Advanced Medicine building houses the new Cancer Center. It's really incredible, and it's located off the Beltway and I-95, and it's accessible on the Metro, on the Blue Line and Silver Line at the Largo Town Center. What an amazing place.
Yes.
Tell us what types of services, first of all, will be provided at this new center.
Yeah. The building is actually called the Center for Advanced Medicine, and the majority of the healthcare there will be focused on taking care of cancer patients. And towards that end, this is the first centralized, unified approach towards cancer care in Prince George's County in terms of offering both the medical aspects of cancer care, medical oncology, radiation oncology, and then surgical specialists to provide, surgical consultations for the care of cancer patients.
Why is cancer screening so important?
Yeah, so we have an opportunity to find cancer at an early stage for citizens of the county. And if we identify them, that means less focus on intensive cancer treatments, earlier return to work, and a good quality of life if we find folks with stage 1 cancer as opposed to more advanced cancers. So that's why prevention and screening is really an important part of our mission at the cancer program there to serve the community of Prince George's County.
You mentioned personalized cancer care.
Yeah.
Tell us a little bit more about what that means and what the approach is.
So really the approach is to identify the person who comes in with a diagnosis of cancer, and we would start with what's called a nurse navigator. And so if you think about going to a really top-notch hotel and you have a concierge who helps guide that hotel, resident through all of the different services and amenities. It's the same thing for a cancer program. A nurse navigator will help the patient identify what appointments they need to go to, what specialists they need to go to, what x-ray imaging tests they need to go to. And there'll be a constant line of communications so that we are really establishing a confidence and a trust in that person with the cancer team that's treating them. So that's really what the basis of personalized cancer medicine is about.
And is that different from more traditional cancer treatment that folks get in other places?
Well, it's more of a issue of building on top of the traditional cancer services. So we would follow, as most other cancer centers would follow, national treatment guidelines in the proper care, high-level care of cancer patients. But here, personalized cancer medicine means that, again, we're focusing on the patient's needs and also listen to the patient's, goals and beliefs so that they feel like they can have confidence and trust in the treatment team that they have.
There are certain cancer types that affect minorities disproportionately.
Yeah.
Do we know why?
Well, I think it's just the socioeconomic factors, especially the prevalence of smoking. We see a lot of tie-in with lifelong poor nutrition or poor eating habits. Perhaps obesity. And so these are some factors in the community that will track towards a cancer prevalence.
If someone were to have a need outside of the services that you mentioned, is there a way that your cancer center could assist folks?
Yeah, absolutely. So that's where it's the University of Maryland Greenbaum Comprehensive Cancer Center. We are a network partner. The hospital is from University of Maryland. Mm-hmm. So what that means is that we would have a focus on the community taking care of patients, but If there are patients with more advanced and perhaps rarer types of cancers, that's where we have this great partnership with the Greenbaum Cancer Center at downtown Baltimore, where we can offer more specialized cancer treatments, immunologic treatments, biologic treatments that perhaps are not available at the Capital Cancer Center. And then, that allows for an access to a portfolio of clinical trials for patients with more advanced or more rare types of cancer problems.
So you could refer out to a clinical trial for if there's a particular diagnosis.
Absolutely, yeah. I mean, and of course, we have a robust spectrum of clinical trials that will be at Capital Region, so that patients don't really have to go, to downtown Baltimore. But there are going to be cases where there's, again, rarer types of cancers that they would benefit from that Greenbaum Cancer Center affiliation.
And what if it's determined in the course of someone's treatment that, for example, they need additional screenings like mammograms or cardiology, urology? Will a patient have access to these types of services?
Yeah, that's what's great about the building, is that we actually have cardiology and interventional pulmonology and gastroenterology specialists in the building, so that we would have those types of specialists available for consultations. And then if the cancer team says that, okay, the patient would need specialized X-ray treatments to further investigate, to stage their cancer, yes, we have a great partnership with radiology, so that we have all the state-of-the-art kind of radiology techniques and imaging available to help define the cancer problem for the patient.
As you know, cancer can be a really scary word for a lot of people when they're diagnosed and starting treatment, and quality of life issues for cancer patients are so important. How is the patient and the family and friends, how are they all helped actually ushered through the process?
Yeah, so quality of life is a very important factor in the successful treatment of a cancer patient. We recognize this. And so we want to get them through the cancer treatments and then return them to their natural life and have a good quality of life. So towards that end, we do have an emphasis on recognizing the patient's needs and beliefs. We would have social workers, but also psychosocial support in terms of cancer patients going through depression or anxiety. And then we would also have occupational therapy, rehabilitation medicine, speech medicine. So that would all help the cancer patient work towards a better quality of life in terms of feeling good about themselves, that their body is functioning and recovered from the cancer problem.
And I guess when they're finished, finishing treatment obviously is an amazing milestone, but it could also be a little daunting to navigate for some folks. Is there any post-cancer treatment there? What does that look like at the new cancer center?
Yeah, and so absolutely. So when we're finished taking care of a patient acutely and everyone's happy that they've successfully navigated their cancer journey, and we say, okay, here's our pattern of long-term follow-up, what we call surveillance, because we don't want that cancer to come back. And then that moves that cancer patient into what's called survivorship. And so the survivorship program at our cancer center really emphasizes, again, good quality of life, return to your normal kind of job and family and life. But then what are the needs in terms of coming in on a regular basis to make sure your cancer doesn't come back? Survivorship also emphasizes, perhaps stopping smoking or idealizing kind of good nutrition so that, there are not downstream problems with your health after all your cancer treatment.
Well, this sounds like a truly fantastic facility and one that is very much needed in this part of the county. Anything you'd like to add that we might have missed about?
Well, yeah, I mean, you said it exactly. It was very much needed because the citizens of Prince George's County have expressed the need for, high quality cancer care that's in the community, that we are paying attention to the needs and the wants of the citizens of the county. And that's really what our main focus is, to listen to the community, provide the care that they ask for, be receptive to feedback from people in the community. It's like, how can we always do a better job? And so that's where it's a very much focused on the community, providing cancer care at that level. But also we have the tie-in with the University of Maryland and the Greenbaum Cancer Center, so that we have really kind of the high-end types of cancer services available as needed.
Wonderful. And the care is not so fragmented anymore for the community.
Right. And if you look at Prince George's County, this is kind of the first center, the academic center with a community focus that has medical oncology, surgical specialists, radiation oncology, rehabilitation, nutrition, psychosocial support. So it's a very integrative cancer program that wants to deliver, the high quality services that are available to the citizens of Prince George's County.
Wonderful. Thank you so much.
Thank you for having me.
We've been speaking with Dr. Magesh Sundaram, the Director of Surgical Oncology and Medical Director of the Cancer Center at Capital Region Health and Associate Professor of Surgery at the University of Maryland School of Medicine. For more information, please visit umcapitalregion.org/cancer or go to WTOP.com and search Top Health. I'm Deborah Feinstein. Thanks so much for joining us, and have a great day.